Hello and welcome to your employee benefits presentation offered to you through Baltimore Washington Emergency Physicians. My name is Megan Ross and I will be going through the benefits that are offered to you starting January 1st, 2023 through December 31st, 2023. Today we'll be discussing the Care First medical plans. There were some slight plan changes this year. The dental plan is still with Care First. There were no changes there. The vision plan remains with Care First with no changes. Your health savings accounts are still with CareFlex. There are increased IRS limits for 2023. And the flexible spending accounts are still with CBIZ and no changes. And then your life and disability insurance has no changes, and that is through Reliance Standard. So with that, I'm going to jump right into your medical plans. There are two medical plans for you all to choose from this year. The first plan is the Blue Choice HMO HSA plan. This is a high deductible health plan. It is also an HMO. That means you need to see providers that take the Blue Choice HMO network. This plan is open access, so you do not need to get a referral from your primary care physician to see a specialist. You also do not have to designate a primary care physician. However, if you have one, you absolutely should list that. This is also a local plan, which means your providers would be in the Maryland, DC, and Northern Virginia area only. However, if you did have an emergency, you do have access to emergency care across the entire country. The plan differences this year do lie within the deductible. The deductible did go up to $1,600 for an individual or $3,200 for a family. The out-of-pocket limit, which does include the deductible, did go up as well, and that is $7,500 for an individual or $15,000 for a family. The out-of-pocket limit is the most you're going to pay in a given plan year. With this high deductible health plan, that means all services, including prescription drugs, are subject to the medical deductible. The only thing not subject to the medical deductible are your preventive care services. Preventive care services include those well child care exams, those adult routine physicals, those age-appropriate cancer screenings. Those are all covered at 100% with no deductible and no copay. So it is very, very important that you take advantage of those free services. Once you've met your deductible, you do have copays for services. So if you went to a primary care physician after you've met your deductible, it is a $25 copay. A specialist visit is a $50 copay. Any urgent care visit is a $100 copay, and the hospital emergency room did go up as well, and that is a $350 copay. Any inpatient hospitalization is a $500 per admission copay, again, once your deductible has been met. Moving on to Plan 2. Plan 2 is your Blue Choice Advantage Point of Service HSA plan. This is still a high deductible health plan as well. However, you can see that you do have in and out of network. So this is benefits. So this is a national plan, and it will allow you to see providers that take the Care First Blue Choice Advantage plan or providers that do not take it. This is also an open access plan, so you do not need to designate a primary care physician, nor do you need to get a referral from your primary care physician to see a specialist. You will notice that the in-network benefits under this plan match the HMO plan identically. So again, in-network, you have a $1,600 individual deductible, $3,200 family deductible. The out-of-pocket limit on this plan is $7,500 for an individual or for $15,000 for a family. Again, preventive care services are covered at 100% with no deductible and no copay. In-network, a primary care physician visit is a $25 copay. A specialist visit is a $50 copay. In and out of network, if you visited an urgent care, it would be a $100 copay, and any emergency room in or out of network would be a $350 copay. Any inpatient hospitalization is a $500 per admission copay once you've met your deductible. You do have that out-of-network benefit. The deductible did go up on the out-of-network as well, and that's $3,200 for an individual or $6,400 for a family. The out-of-pocket went up as well. That's $14,000 for an individual or $28,000 for a family. It is very, very, very important that you access in-network providers. As you can see, you have higher deductibles and higher copays if you do seek out-of-network care. So make sure you are finding those in-network providers. Both plans include pediatric, dental, and vision for children under the age of 19. Both are full dental and vision plans, so a routine eye exam is covered at 100% with no deductible, no copay. Any frames, contacts, lenses through the pediatric collection only are also covered at 100% with no deductible, no copay. The dental deductible is separate. That is a $25 per child deductible. That is waived for your preventive services. Preventive services are those 6-month cleanings, yearly x-rays. Those are, again, covered at 100% with no deductible and no copay in network. Your basic and major surgical services, so fillings and extractions, are all covered at 80% after that deductible. Major restorative services, crowns, inlays, onlays are all covered at 50% after that deductible. Children do have medically necessary orthodontia coverage, and that is covered at 50% after that deductible. It is not a life-qualifying event to add your child to the standalone dental and vision plan if they age out of the pediatric benefit. So if you know your child is turning age 19 at any point during this calendar year, you need to make sure you put them on the standalone dental and vision plan at open enrollment. Prescription drugs are covered at a copayment once you've met your deductible. While you are meeting the deductible, you will pay the negotiated fee for that prescription and where you get it filled at. Once you've met your deductible, you do have copays for prescriptions. Your Tier 1 drugs, those are your generic prescriptions, those are covered at a $15 copay for a 30-day supply. Any Tier 2 drug, which are your preferred drugs, those are covered at a $45 copay for a 30-day supply. And any Tier 3 drug, those are your brand name drugs, those are covered at a $65 copay, again for a 30-day supply. You do have the option to do mail order, which is a 90-day supply for 2 times the copay. Where you get your prescription drugs filled matters. So I would encourage you all, if you do take a prescription drug, to use your drug pricing tool in your CareFirst member portal or mobile app. You can actually type in the name of the prescription of what you get filled, the quantity that you get filled, and the location of where you would like to pick it up, and it will estimate your out-of-pocket costs at each in-network pharmacy. You would see instant cost savings if you changed where you got your prescriptions filled from, let's say, CVS, Walgreens, Rite Aid, to your local grocery store or your Sam's Club, Costco. So I would encourage you to take advantage of these tools that are available to you. On your CareFirst mobile app or member portal, you do have access to drug and pharmacy tools. We did talk about the drug pricing tool previously. You can also find an in-network pharmacy. You can request, refill, or transfer a prescription to mail order. There's also the drug resources such as the preferred drug list or drug claim forms. Access to CareFirst video visits through their medical plan. This allows you 24/7, 365 days a week access to board-certified physicians from the comfort of your own home, through your smartphone, tablet, or from your computer. This is a cost-effective and confidential way to seek care from the comfort of your own home. These are for your non-emergency situations such as fever, flu, infections. They can even write prescriptions. You can also seek treatment for therapy, psychiatry, diet and nutrition, and then breastfeeding support. For your non-emergency situations, such as the fever, flu, and infections, while you are meeting the deductible, the most you would pay for a video visit is up to $69. Once you've met your deductible, it is a PCP copay. All members have access to the CareFirst My Account and mobile app. The mobile app and My Account we have referenced previously. On here, you can find an in-network doctor or urgent care center. You can review your medical benefits. You can check where you are in your deductible and where you are in your out-of-pocket maximum. You can check the claims that have been submitted for you. You can also estimate your costs. So similar to the drug pricing tool, there is a procedure pricing tool. You can also view your ID card and refill that mail order prescription. All members have access to the wellness resources, which is through ShareCare. Through ShareCare, you can have access to health coaching, weight management, tobacco cessation, and financial well-being resources. All of the ShareCare resources are located on your CareFirst member portal. Moving right along to your health savings accounts. Your health savings accounts are still through CareFlex. Health savings accounts allow you to use pre-tax funds to pay for health care services for you, your spouse, or your eligible IRS tax-dependent child. There are IRS limits as to how much you can contribute to the health savings account, and that does include the employer contribution from Baltimore, Washington. For 2023, the IRS limit is $3,850 for an individual and $7,750 for a family. Baltimore Washington is going to continue to contribute to employees' HSAs. If you are enrolled in individual coverage, they are going to contribute $2,500 annually. And if you are enrolled in family coverage, they're going to contribute $4,000 annually. If you are over the age of 55, you can do an additional catch-up of $1,000. To be eligible to contribute and open an HSA, you cannot be covered by a spouse's non-qualified plan or healthcare FSA set up by you or your spouse, enrolled in Medicaid, Medicare, or TRICARE, or eligibly claimed as a dependent on another person's tax return. It is very important that you check your HSA very carefully. Your children can stay on the medical, dental, and vision plan until age 26. However, they are not IRS tax dependents past about age 20, so make sure you track that very carefully. HSAs can be used to pay for eligible medical expenses, such as medical copays and deductibles, dental and vision expenses, medical equipment, and even prescription drugs and over-the-counter drugs and menstrual care products. HSAs are probably one of my favorite benefits that an employer can offer because you are in control of how much you want to contribute and how much you want to spend of your HSA dollars. It is the only thing that has a triple tax advantage. It goes in tax-free, it grows tax-free, and comes out tax-free, and there are no use it or lose it restrictions. So if you don't use your funds, they just continue to roll over year over year. HSA contributions can be changed on a monthly basis. However, it is very important that you track your HSA contributions yearly to make sure you do not exceed the IRS calendar year limits. HSAs can only be offered and contributed to if you are enrolled in either of the Baltimore Washington medical plans. These are your own HSA accounts, so if you do happen to retire or leave Baltimore Washington, you do get to take your HSA with you. Moving on to easy topics now, dental and vision. So your dental remained unchanged, that is still with Care First. This plan has a plan year benefit maximum of $1,000 per person. It has a plan year deductible of an individual of $50 and $150 for a family, and any preventive and diagnostic services. So again, those 6-month cleanings, yearly x-rays, those are all covered at 80% with no deductible, no copay. Any basic services, fillings, periodontic scaling, and simple extractions are covered at 50% after that deductible. Major surgical and restorative services such as endodontics, periodontics, bridges, inlays, onlays are all covered at 50% after that deductible. This plan does include ortho services for children under the age of 19. It is covered at 50% with a lifetime maximum of $1,200 per child. Vision plan remained unchanged, that is still with Care First. Care First uses Davis Vision. Davis Vision is one of the largest network of providers. It's not only those private practices, but it is those large retail chains as well. Vision works a little bit different. It is on a 12-month rolling calendar year basis. So if you went for an eye exam today, you would not be eligible for an eye exam 12 months from today. That same concept applies to your lenses, and frames are once every 24 months. A vision exam under this plan in network is covered at a $10 copay. Any single, bifocal, trifocal, or lenticular lens is covered at a $20 copay. Any Davis Vision frames, so those are going to be your free frames, are covered at a $0 copay. Any non-collection frame, those are your designer frames, those are covered at a $130 benefit. Anything over that is a 20% discount. You do have non-collection contact lenses covered at a $130 benefit with a 15% discount on that. And then any Davis Vision collection contact lenses are covered at a $0 copay. You do have an out-of-network benefit on the vision plan. However, you will pay more in premiums than you would actually be reimbursed. So make sure you find an in-network vision provider. Flexible spending accounts are through CBIZ. Baltimore Washington's offers a flexible spending account to allow employees the option of participating in a healthcare and or dependent care FSA. An FSA allows you to save money on healthcare and dependent care expenses by using pre-tax dollars to pay for those eligible expenses. Healthcare FSA is set up for your medical co-payments, deductible expenses, such as medical, dental, vision, physical therapy, chiropractor treatments, and medical or mental counseling. Your dependent care is to cover those child care expenses for children under the age of 13. It also is for daycare for any physically or mentally incapable dependents. You are not required to enroll in the medical plan to participate in either of the healthcare FSA or dependent care FSA. There are limits as to how much you can contribute into the healthcare or dependent care FSA. The healthcare FSA, the maximum contribution for this year is $2,750 with a rollover benefit of $550. That rollover benefit is subject to you re-enrolling in this benefit. The healthcare FSA is for, again, those medical co-payments and deductible expenses, any prescription drug co-payments, dental, orthodontia, over-the-counter medications, including feminine care products. You are not allowed to contribute to a healthcare FSA if you are enrolled in the HSA. The dependent care FSA has a maximum contribution of $5,000 or $2,500 if you're married and file a separate tax return. This benefit is, however, available to all employees, including if you have the HSA. This is for eligible expenses that are associated with child care under the age of 13. Again, you are not required to be enrolled in either of the medical plans to enroll in either of these benefits. Claims must be incurred between the 1/1/2023 through 12/31/2023 plan year to be eligible for reimbursement. Some examples of eligible dependent care FSA expenses do include child care, nursery school, before and after school care programs, adult care, and in-home dependent care. The healthcare FSA does have a rollover benefit of $550. The FSA rollover provision allows employees to roll over up to $550 of unused healthcare funds at the end of the plan year. However, if you do not re-enroll into the benefit, those funds will be forfeited. Any funds over the $550 will be subject to the use it or lose it rule and will be forfeited. The FSA rollover does not apply to the dependent care account. The FSA plan year, so expenses must be incurred during the January 1st, 2023 through December 31st, 2023 plan year. All elections are in effect for the entire plan year, and your contributions cannot be changed unless you have a life qualifying status change mid-year. Employees do have 90 days from the end of the plan year to submit claims for expenses incurred during that plan year. Life and accidental death and dismemberment insurance through Reliance Standard. This is provided by Baltimore, Washington at no cost to you. The life insurance benefit is 1 times your annual salary up to $300,000. It does have a matching accidental death and dismemberment benefit. These benefits are all guaranteed issue, so no questions, medical questions are being asked. All full-time employees are also provided short-term disability. This is a 100% employer-paid benefit. Employees would receive 60% of your weekly salary to a maximum of $2,000 per week. Benefits begin on the 8th day due to an accident or illness, and then benefits are payable for up to 12 weeks of approved disability. All of the benefits that we just discussed, except for the HSA, are in effect for the entire plan year, unless you have a life qualifying status event that will allow you to make plan changes mid-year. A life qualifying event is marriage, divorce, change in number of dependents, loss of coverage, birth of a child. There are about 20 more different things, so if you do have one of these events and you wish to make changes to your plan mid-year, you need to contact Human Resources within 30 days of that qualifying event to make changes. Please note, birth of a child, your child is not automatically added to the plan. You would need to get with Human Resources to have that child added to the plan. Also, please do not wait for their Social Security number. We do not need that to get them added. We would add that after the fact. Open enrollment will be through Kelly & Associates again this year. Open enrollment starts December 5th and runs through December 16th. All employees should go on to the Kelly & Associates website and go through their enrollment for this year. However, if you do not wish to go online, the benefits that you have currently will roll over to the new plan year. However, I would very much encourage you to go on and make sure all benefits are still up to date for you. Thank you for listening to today's presentation. Please feel free to reach out to me with any questions you may have.